Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Deoxyribonuclease. Deoxyribonuclease is also an important enzyme for Streptococcus. Okay, what does this deoxyribonuclease do? It is also called as streptodornase. This deoxyribonuclease is of four types. We have type A, type B, type C, and type D. Among all these, type D is very important. Okay, one important thing in deoxyribonuclease is it will deoxyribonuclease nucleic acid is present in DNA, so it will lyse the DNA. Okay, so this whenever the anti DNA ASB is more than 300 to 350 units, international units, then you can think that there is either pyoderma or glomerulonephritis can be diagnosed with the help of this anti DNA ASB. Actually, even in rheumatic heart disease, there are two things. ASO titer is raised, and even anti-DNA ASB is also raised in rheumatic heart disease also. But ASO is diagnostic because it is easier to measure. So ASO is diagnostic is one of the important factor in rheumatic heart disease. Whereas in pyoderma and glomerulonephritis, ASO titer is very low. Because ASO titer is low in pyoderma and glomerulonephritis, we generally use this anti-DNA ASB is used. What does this anti-DNA ASB does? It will liquefy the pus, because actually what does pus contains? Pus contains organisms and the cells, right? WBCs actually. Pus contains organisms and cells, because organisms are definitely streptococci, whereas cells are WBCs. So if you see, when the deoxynuclease is given to this thick pus, this deoxynuclease will destroy the DNA. So the DNA present in the cells is destroyed, and even the organisms are destroyed. So as a result, the thicky nature of the pus is lost, and it will liquefy the pus, and thus it is used in empyema. Empyema is presence of pus in the pleural cavity. So deoxyribonuclease is used in empyema in order to liquefy the thickened pus. So in this empyema, actually streptodornase is actually this deoxyribonuclease along with streptokinase, which is a fibrinolysin. So both these are used as combination in empyema.
thank you and thank you for watching.